Hello everyone, I'm Michelle Lyons and welcome back to this latest edition of my Meet the Experts series. I'm so lucky to have so many clever friends who are very generous with their time. And Dustienne, I was trying to figure out when we met. I think it was 2012. I'm going to say it was in New York.
Oh gosh, actually it was in New York. Yep, and I think it was before 2012 because that's when I moved to California. So I bet it was like 2010. No. We may go way further back.
Okay, we're going to have to discuss.
We'll look it up. We'll look at
wine. You know, this is going to. We'll have to debate.
Yes.
So Dustienne, for those of you who don't know her, is she's not only a highly esteemed colleague and fellow faculty member with Herman and Wallace, and she teaches all over the place, but she manages to bring together beautifully the art of being a yoga teacher and being a women's health physical therapist. And I think she marries those two beautifully, along with a commitment to living well and, you know, really kind of walking her talk as well, and marrying, again, the spiritual as well as the physical aspect of all that she does. So we're delighted that, you know, it's one of Dustienne's courses has been on my bucket list for a long time. I've loved her DVDs, and we'll put links to all of those below. But we're delighted that she's coming to Ireland in December. So we're super excited to have her coming to talk to us about yoga and pelvic pain. I put out a call on social media earlier today to ask folks what were they interested in learning about the connections between yoga and pelvic health. So we got some really interesting questions. So Dustienne, we're going to just have a little chat about that and maybe talk about what you're going to be teaching in Ireland when you come in December, if that's okay.
Fabulous.
Okay.
Love it. Love it.
So first question. When it comes to postnatal abdominal distension that is slow to resolve, what advice have you for breathing technique with a urethral prolapse and stress incontinence?
So in regards to a specific breathing technique, I would have to say I would want to broaden my response to include also looking at standing mechanics. So looking at that traditional, as we know, that proprioceptive change that happens during pregnancy. Let's say that this is the person's front of their body here, so they're looking this way. Very often the plumb line, we'll see the rib cage behind the plumb line, maybe the pelvis shifting forward, maybe the rib cage now is tucked under. So now we're finding that there's maybe less diaphragmatic excursion, more oblique overactivity, more of a functional lengthening of the abdominal wall. And then when people are inhaling, they're pressing down on the pelvic floor, maybe potentially making prolapse worse. So I would say right off the bat, rather than what I tend to do, rather than giving people breathing exercises, is more, let's look at them functionally in different positions. How are they standing? How are they sitting? Are they also afraid to go into different positions like quadruped? So look at that first, and then look at the ability for them to expand their belly when they're taking a breath in, seeing if they're doing any paradoxical breathing. And then if we wanted to layer specific breathing techniques, we could do a dirga breath, which is a 3-part breath, which is when you inhale into the belly, allow the breath to come up into the rib cage, allowing lateral expansion in the rib cage, and then a gentle collarbone float up at the end.
Gorgeous. And I wonder, Dustienne, you know, what you would think. I mean, there was some interesting research that came out a couple of years ago. I think it was Subramanian, looking at how just 5 minutes of alternate nostril breathing a day can really change cardiac autonomic output. And I wonder sometimes if some of that protective posturing that we see in postnatal women who maybe are having prolapse issues, you know, the nervous system is a little bit overactive, there's a lot of tension. And I wonder if, as an addition to what you've talked about, perhaps there could be a role as well for just calming down the nervous system, maybe with a little bit of alternate nostril breathing as well.
I love that. Do you think we could do that right now?
Please lead us.
The alternate nostril? Okay, that would be fun.
We will follow.
So we could do it like this, or I like to do what's called Vishnu Mudra, which is when you take the second and the third fingers down like that. And then you bring your thumb to your right nostril, and then you inhale, Switch, exhale. Inhale, switch, exhale. And then you would go back and forth. You could also do it like this. But I think there's something really beautiful about this. As you get very quiet and you're into the breathing, it gets very, like a little beautiful piece of choreography to go back and forth. And the ancient practice has shown, or has, people do it to stimulate different sides of the hemisphere. And I've also, I don't remember the name of the author, but I did see a study that showed that alternate nostril was as good as paced breathing.
Oh.
Which kind of surprised me, because I thought the extra focus and the alternate nostril stimulating the hemisphere would be better. But, and again, we can look at the study itself. But I think you're 100% right. Get the nervous system into a more optimal balance with less sympathetic overdrive.
Because I think, you know, that's what's beautiful about your toolbox, is that you're able to pull on that, on the yogic wisdom, but also then, you know, to acknowledge from a physio perspective the role that the diaphragm and the pelvic floor have together. So I think those two strategies really complement each other. And then to be able to integrate that into movement, because that's where we spend our days, isn't it? You know, our jobs, for me, all roads lead to
Absolutely. Absolutely.
Okie doke. So, another question. I'm confused with the way yogis breathe. Inhale on the exertion to give energy to the movement. How does this work for the postnatal or prolapse client?
Great. So I just did a blog about this, so I'll send you the link about that. Super. And my whole thing is, do what your body's wisdom is telling you to do, because very often, you know, when you're treating patients, you say, how do you think this started? Well, this sounds crazy, but it's like, it's actually not crazy. It's totally how it started. So I always refer back to, what is your body's wisdom telling you?
Nice.
Then layer on top of that, when we know through seeing the functional MRI studies that when one inhales, the diaphragm descends, the pelvic floor descends. When we exhale, we have both the lifting back up. So I think about, how do I want to pair that with the breath and then with the spine? So for example, with cat-cow, if we come into spinal flexion, I'll pair that with an exhalation, and perhaps if we're working on uptraining, also a pelvic floor muscle contraction.
Okay.
And that's the beauty of a yoga practice, I think, is that you can tailor it to your patients who you want to have the down training for, but you can also tailor it for the up training. Nice. So maybe if I'm working with a client who is working on more strengthening, I'm having them practice a little bit extra TA contraction and pelvic floor muscle lift on the curl. But maybe for my patient who has tailbone pain or vaginal pain, or vulvar pain, I should say, maybe I'm thinking about releasing the tailbone on spinal extension, offering the input and the verbal cues to spread the ischial tuberosities.
So the breath,
so you can tailor it.
Intention.
Yes. Yep.
Nice. Nice. Okay. Because I think sometimes people can get attached or a bit dogmatic about, no, you have to breathe in during this phase. And I think you just explained it beautifully, that just to have that little bit of flexibility and working with your body where it is now, you know, on the spectrum of moving.
Exactly. And if you think about things like someone walking down the street playing an instrument, they have to be able to exhale, but their pelvic floor isn't staying contracted the entire time. You know, we can do the reverse. I can inhale and contract my pelvic floor. That's not a problem. But I think we can use the breath to augment what's happening. And then if we're concerned about too much downward pressure, we can use that during the movement.
Beautiful. Beautiful. Okay, let's see, what else have we got here. For clients returning to yoga after hysterectomy, what poses should they be cautionary about?
So that, I would always say, if I had a client coming to me with that question, I would always defer back to obviously the surgical guidelines with their particular doctor. But if we look at where people are before the 6 to 8 week mark, they're doing some diaphragmatic breathing usually, they're doing some pelvic tilts. So maybe including the breath awareness with that, both for the contraction and the relaxation, maybe doing some pelvic tilts, maybe doing some cat-cow. In terms of things I would avoid stretching the surgical site before that's appropriate for them. Maybe doing something like a warrior one, where there's a little bit of a hip flexor lengthening without too much pulling at the surgical site. Obviously, anything on their stomach, cobra, is not going to be indicated until it's past, the appropriate time. But I think getting in there early, doing the combining the TA with the diaphragmatic breathing, getting some blood flow into the pelvic floor and the coordination piece, and maybe doing some standing postures could be really nice for people.
Nice. And I wonder then maybe moving into that kind of more medium to long term, because we know that bone health and bone density is an issue for a lot of women after hysterectomy. So maybe that might be an appropriate time to introduce maybe some tailored versions of Cobra or Locust, some of the more, gentle spinal extension poses. Because we've all this gorgeous research, don't we, showing that spinal extension can not only halt, but potentially even reverse osteoporotic changes. So
absolutely.
It's wherever they are in the spectrum, I think. But just to restore that little bit of thoracic movement, because I think sometimes after a laparoscopic hysterectomy, particularly when a woman's in that kind of reverse Trendelenburg, there can be that little bit of phrenic nerve irritation and diaphragmatic inhibition. So what I love is just some gentle twists as well, maybe just to start bringing that bit more depth into the mix. So I suppose it's where you are in the spectrum of recovery, and just working with the body that you have in your day. I'm really sorry, we've got a little time lag.
Yes, it's pouring here in Boston, so it's probably why.
Okay.
Yeah.
Unusually, it is not raining here in Ireland, so fingers crossed.
I got it I'm making it for you.
Thank you. That's very good of you. I want to talk to you specifically about yoga for pelvic pain, because I think there's a really interesting body of research emerging, looking at a combination of yoga and mindfulness. Some interesting studies, particularly coming out of the military, looking at the benefits for these two approaches for pelvic pain and even for PTSD. And I wonder if you could just talk about how you feel yoga is beneficial for women with pelvic pain a little bit.
Sure, yeah. I would say one of my favorite things about it is having the locus of control back.
Yeah.
So very often, our patients come in and they've been to multiple providers. It's been a long diagnosis, which is traumatic in itself. And having something they can do at home may or may not Yeah, sure.
And we're back. I just paused because our internet was a little bit fuzzy there for a moment. So I'm so sorry to cut you off mid-flow there.
Not a problem. So you had asked about why I like to use yoga for patients with pelvic pain. So I think one of the scariest things for our patients going through the medical process of healing is that they don't often get a diagnosis right away. And if they do, it's not necessarily as clear cut as, oh, you have a wrist fracture, you will be in, of course, that's I think that one of the beauties of a yoga program is you can help people achieve their locus of control. So they can have something that they can do at home. They may find helps calm anxiety. They may find helps decrease pain, or helps them bend over to pick up their dog, feed their cat or something. So having something that they can do independent of relying on another practitioner is my number one favorite reason why I like to give yoga for home programs. Obviously, the mindfulness component is huge, so you can really help give people strategies on how to deal with the pain when it comes, how to deal with the anxiety about the pain, catastrophizing, working with kinesiophobia. Along the kinesiophobia lines, thinking about grading movement. So for somebody who may have pain with child's pose, working with a hip rock back to try to get more hip flexion, and work with decreasing kinesiophobia around having a fuller amount of hip flexion. That's why I love it. I think it's portable. It's easy. I treat a lot of college students, so they can do their home program in their common space, and no one knows that it's for the vagina, which is wonderful. And it's something that people can share and bond with. Oh, let's go to a restorative yoga class on Friday night and relax after the week. No one necessarily needs to know they're doing that because they have bladder pain.
Yeah.
So, yeah.
And I think, that's the joy of it, isn't it? Because you can tailor it for the person. If we're talking about somebody who's maybe dealing with endometriosis, and maybe they've had their laparoscopic excision, and the pelvic floor muscles don't necessarily always get the memo that the disease has been removed. So there will be a lot of gripping and tension and restrictions in the center of the body. And I think, it's a lovely way of being at peace with your body and meeting it where it is. And I think, what the depth that you bring to the table in terms of tailoring, and that's what I really love. It's that kind of bespoke approach that you have, that I'm going to work with you today where you are, because yoga is not, I think yoga's had a bad image for a couple of years, that it's essentially for bendy, young, white, affluent women,
Yeah.
And it's what I love about you in your DVDs is that you show it's for everybody, that everything is modifiable and figure outable. And I think that's because you wear those two hats and you switch between them so effortlessly, and it's very elegant, the approach that you bring. I know that anybody who knows me knows that I'm slightly obsessed with constipation. And I think it's a good thing to be obsessed about. What does yoga have a role to play in terms of bowel health, constipation, digestive health? I saw an interesting study lately showing that when we compare the a low FODMAP diet and yoga for patients with IBS, they were equally effective.
Oh, I haven't seen that study.
Oh, I'll send you the link.
Yeah, that's cool. That's cool.
So I wonder if you think, why could that be? Because, we think food, biochemical constituents. How could yoga be as effective as a FODMAP diet? Do you have any thoughts on why that might be?
That is so cool. And right away I'm thinking, I feel like adding that one other tool, I have a nutritionist in mind who I work with who does a lot of FODMAP stuff. I'm thinking, wow, if we can combine all the things, just throw it all, give all people the non-invasive options as possible. But yeah, so I like with for people with bowel issues, obviously I love a lot of twists.
Yeah.
Right. So we can stimulate and lengthen different aspects of the colon, breathe into the belly, obviously, doing some self-manual therapy in different postures. So maybe if they're in a spinal twist with the knees to the left, I could massage along the ascending colon and then switching it out. I think also reprogramming from the fight or flight response, which happens, for some of our patients who maybe aren't able to have a bowel movement in the morning when they want to, and then they're experiencing pain or fear. Having a strategy to come into. So when you're on the subway, you can say, okay, I know I can't poop now, but I'm going to just feel my sit bones. I'm going to imagine my pelvic floor is lengthening. I'm going to feel the space between my tailbone and my pubic bone, and finding a way to kind of come out of that spin.
Gorgeous.
Yeah. And then, of course, all of the myofascial connections. Warrior One is so nice to elongate, and
it's just such a win-win situation. I think if we can integrate therapeutic yoga into our toolboxes, because you really are, and it's such a cliche to say it, but you really are integrating mind and body, and just the way I felt when I started practicing yoga was I really just felt like I was coming home to myself.
Oh, yeah.
And just that kind of, I don't know if you ever ride horses, but it's that kind of, sitting deep in the saddle feeling, that you're okay.
Nice.
I'm steady here. And I know when it's been a few days, like if I've got a crazy travel thing going on and it's a few days before I can do, I know, body and mind, that, you know,
Mhm.
it's time. It's time.
Mhm.
And I think particularly what I'm excited about hearing you talk about in December is just how you bring that together, because we know that for so many women who have pelvic pain diagnoses, whether we're talking about pudendal neuralgia or bladder
Mhm.
pain or endo or, you know, constipation even, that
Mhm.
a lot of the perpetuating factors are that, you know, the wound up nervous system, the fear of breathing into that part of ourselves, just the dissociation from our bodies.
Yeah.
So I've loved your DVDs for years, and I love the practices that you have available on your website, and we'll link to all of that below. But I'm I'm excited because I think we're living in a time now where science is actually catching up with what you've been talking about for a long time.
Yeah, yeah, it's wonderful. And one thing I thought of when you said when you haven't been to class and you've been traveling a lot,
Mm,
I love the idea of how we can, over time with practice, learn to take a moment, a mindful moment.
yeah.
So for minds that are maybe in a lecture and they have pelvic pain, can you remember that feeling during your 20-minute yoga practice where you soften the sit bones and
Yeah.
integrating that into our day-to-day?
Nice, nice.
Yeah.
Can I ask you, in your opinion, what, you know, do you encourage people to have a daily practice? And if so, like, what's a good amount of time for people to spend on a daily practice? Do we have to do 3 hours a day?
Oh my gosh, no.
Good.
Oh my gosh. So what I usually do, which is what I do for any home program, is say, can you try to do this 5 to 7 times a day? I'm sorry, 5 to 7 times a week, because usually, yeah, that would be different. Well, although in some cases, neuro-re-ed,
Yeah,
that I'd make an argument for that. But um, in that case, we know that people are probably going to get 3 to 5 times in, just because we all have good intentions. I am one of them. And then the day gets away from us and that doesn't happen. So I think in the beginning, when people are trying to develop new habits, trying to carve out a daily practice of 20 minutes for a habit's sake,
mm,
or even if it's 5 minutes, sometimes I'll work with people and say, can you just schedule in 5 and
yeah,
make it a scheduled thing on your calendar so that it becomes a habit and so we can really shift things.
nice.
But I don't think it has to be a lot, because the idea is that you would then integrate everything into your day to day.
Mm,
So as I'm sitting here with you, I can feel my sit bones in my chair. I can feel my feet flat. So that is a practice.
yeah.
I don't have to be in my yoga pants and in a hot room to be doing my practice.
I think that's a really important point, because I think sometimes there can be a tendency to feel that unless you're in the beautiful room with the incense and the music and it's all
Mm-hmm.
perfectly set up and you've got the bolsters and the cushions, and then you have to wonder, well, is it, you know, who's doing the yoga? Is the room doing the yoga, or is it you doing the yoga?
Mm-hmm.
You know, and to be able,
Mm-hmm.
I think for you to be able to transmit that message to busy women particularly, that no, you
Yeah.
know, all you need to bring is yourself and your will, you know, and your commitment and your intention.
Mm-hmm.
I think that's a really powerful gift
Yeah.
that you can give people.
Yeah.
I can't wait to, you know, for your
I
class in
can't
December. I'm so
either.
excited.
And
So,
I have someone here who'd like to say hello to you.
oh,
I have Penelope here.
Penelope, oh, Penelope.
So she voted recently here in the States, so that's why she's got her extra voted sticker.
Thank you.
But
Thank you.
Penelope the Pelvis is my dear spokeswoman for all things women's health physio, so you can
Excellent.
check her out via her hashtag.
I will. I'll bring along some of Penelope's Irish cousins for you
I would
to
love
your
it.
class.
I would love it. And the giant poop pillow I see in the background.
Oh yeah, just
And the
hovering
bladder.
delightfully over my head there. Yes.
Oh, I've got, let's see, my friend Shireen gave me this little friend. She matches your
Gorgeous.
little bladder in the background.
Oh look, that's so
Yeah.
beautiful. Dustienne, apart from your much anticipated trip to Ireland, where can people find you? Where are you teaching? And I'm going to put a link to your website, Your Pace Yoga, as well below.
Oh, great. Thanks. Yeah, Your Pace Yoga is perfect. I also have a clinical practice here in Boston, which is called Flourish Physical Therapy. Put out a monthly newsletter with a lot of patient-centered blog articles on posture, bladder habits, bowel habits, posture of the month, and everything. So I encourage people to hop over to the website and sign up for that.
Nice. And on social media, where can people find you?
I am Your Pace Yoga. So that would be my Twitter handle and my Instagram handle. And then my Facebook is a long one. It's Dustienne Miller, Your Pace Yoga. But they can find me through you.
They'll find you. Yeah. They'll hunt you down.
Yeah.
Dustienne, thank you so much. I've been a fan for a long time on a number of different levels, and I'm super excited that you're going to be coming to teach us. And even if you can't come to Ireland to attend Dustienne's class here, you can go to the Herman Wallace website also and find out about her extensive 2-day class that she's teaching. But do yourself a favor, and even if you can't catch her in person, just have a look at the videos and the DVDs as well, because they will enhance your life.
Wow. Thank you, Michelle.
Thank you for everything.
Thank you.
For all the conversations, and we look forward to seeing you in a couple of weeks.
It'd be fabulous. Thank you.
I think so. Okay.